am Sekeita Lewis-Johnson with LER. I have been a nurse for over 20 years. I'm currently a board certified family nurse practitioner and IBCLC and birth doula. I actually started my career in nursing right out of nursing school, right into maternal child health. I have years of experience. Officially been an IBCLC for over 10 years. I think it's been 11 or 12 now, but they're just going to do the over 10-year thing. I have worked in a hospital setting as an IBCLC. I work in the community still now as an IBCLC, private practice, and I'm just happy to be sharing this wealth of knowledge with everyone today. Before we dive in, and what you want to keep in your mind during the discussion today is and keep them at the forefront as we're talking. It might be helpful to write them down. So, do I have the skills necessary to become an IBCLC? We're going to talk about those skills today because I think that when someone hears the word skills, they automatically jump to, the hands on, the doing, all of that. I'm talking about a whole heap of other things, but do I have the skills? And if not, where can I acquire these skills? So, that's that second part. So just be cognizant of that. And we're going to hopefully help you make sense of it. And don't worry if it doesn't make sense the first time. Sometimes people need to hear this a couple times. So this will be recorded. So, what makes an IBCLC? I talked about skills. Competency is critical. It is really necessary to make sure that you provide the adequate and appropriate lactation support. That's what competency means. It means that you have the ability, the knowledge, and the skill to do it successfully. And so, in a nutshell, we talk about from novice to expert. Novice is that, no, I'm not. I'm not there. I'm not as competent, right? But there's this rationale and reasoning for the different pathways, but just keep those in mind. At the end of it, you want to be confident that you are doing no harm. And that's essentially why competency is important. Culturally appropriate and credible. Let's really unpack what culturally appropriate means. If you've worked in healthcare or been around anyone, or even in other business sectors, you might have heard the word culturally competent. That word, I just talked about what competency is, right? Can you ever become competent in someone else's culture? You need to really be clear. As we have been talking about language and how language is so important these days, we want to make sure we are using terms that make sense, really. So, culturally appropriate is more fitting for where we want to be. And being culturally appropriate starts with cultural humility. And cultural humility is defined as a lifelong process of self reflection and self critique, whereby the individual not only learns about another's culture, but starts with an examination of their own beliefs and cultural identities. And that definition can be found from the National Institute of Health. That is just one definition of cultural humility, but it really is a lifelong process. So when we're talking about cultural humility, some people they say things like it's not in their culture to do X, Y, and Z. We know that we want to avoid saying that really. We know that within cultures, there are subcultures. So the first part of cultural humility is not really feeding into stereotypes, not making assumptions about what someone will and won't do based on their culture, right? Because you really don't know unless you've been told by that particular person. So, culturally appropriate care is that individual care, but also starts with us first examining ourselves. Credibility. Are you a credible resource? When you're asked something and you don't know the answer to it, how do you respond? Do you try to answer it off a whim of your lived experience? I'm saying that and I'm using that example and I'm asking that question because especially as it relates to breastfeeding and chest feeding, everyone will want to tell you their story, right? Their story. Oh, it didn't hurt me. Oh, it hurt really bad, right? You want to not rely on your own experience. You really want to rely on the evidence. So being a credible resource means you are giving out the information, A, that coincides with the best evidence, and B, you really know what you're talking about. That's the second part. So, do you know what the evidence says? Or if you don't, do you know where to go find it? We're not walking dictionaries or walking computers. It's impossible to know everything. So showing credibility is really about, okay, I know enough to say, I really don't know that, but let me get back to you because I got a resource that I can dig into. So credibility means everything. One of the things that happens if you lose credibility as a lactation consultant or lactation supporter, that means that the most of us will lose credibility also. People begin to not trust really that we can be helpful or that we can help them with their goals. So, a couple of the other things that we do as IBCLCs is we advise on policy and we actually help create policies. And that's important to know because, from a standpoint of talking about clinical care, remember I said, do you have the skills necessary? So, what if you have strong skills in policy? I'm like, okay, yay, we need you. We need you because, as I said before, language is important. The language and policies matter. And so if you are a policy person, that's your thing, you already have that piece of it. But also being at the table to know how policies are created. So maybe it's not your strong suit, but you really want to know how policies are created and how they impact us. And that then informs your advocacy. That informs a big, big, big part of what we do and who we are. And a person that's an advocate is simply a person who publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created. Problem solvers. This is probably about 90% of what we do because each family has their own components. And so we really, when lactation consultants are called for support, it is to help solve usually some type of problem or issue that a person may be having. And so sometimes we get into this one size fits all. Just know that one size never fits all. And we really need to be problem solving towards individualization of that particular family and what concerns they're sharing. Along with being a problem solver, remember I said sometimes you have to go back and say, I don't know this. Researcher. There's two ways to be a researcher here. You can be a person who carries out academic or scientific research. Yeah, we need that too. In this profession, we have those in this profession, lots of researchers. Or you can be that person whose job involves discovering or verifying information. And that is all of us. Let's remember, I said we're not walking around with everything up in here. We have to have our tools that we reach out and say, oh, I know how to research this and get the correct answer to help effectively solve the problem, not going off of our whim. High level lactation care and skilled lactation care. Those go hand in hand. And when we talk about high level lactation care, I'm going to give you an example of basic breastfeeding care, which is assisting with latch and positioning when the infant and parent are both well. There's really no other issues other than I just need this little bit of assistance versus someone in an ICU who was lactating prior to going to the intensive care unit and being intubated with a breathing tube. Are you able to deliver that type of care? Are you able to look at medications and say, whoa, this person is intubated and maybe they have a brain injury? How does that brain injury impact lactation? Are you able to make that connection? So when you're doing your training, sometimes it's so much and you're like, well, why do I need to know about the brain? You need to know about the brain because it is that level of care that sets the IBCLC apart, that can make the clinical decision making that it is appropriate for that level of care. So we talk about acuity, which is the level of care. So skill, do you have the skills necessary? And I'm going to tell you right off, I just gave you the worst of the worst, like somebody intubated and all of that. The expectation is that you're not going to end your whatever clinical experience you have and maybe have that level of. However, that is what I mean is that once you build your skills and you build your skills and you build your skills, knowing enough to say, well, that's not my knowledge set, but let me figure it out, right? Essential and timely. One of the things that we found out is essential is a new buzzword during the pandemic. We found out that yes, lactation consultants are essential because babies still need to eat, people are still having children, and especially during a pandemic, promoting and protecting the ability to provide Human milk is critically important, not from just, the bonding and the family, but also from a public health and prevention standpoint. So we are essential, and it is important that we show up when they need us, that we're timely, that we can't say to folks, we're in a pandemic now, so I don't know when this is going to be over. You're on your own. No, no, we are frontline workers. And so I just want to make that really clear that yes, we talk a lot about telehealth. We really do. We talk a lot about telehealth. But I'm going to give you some things that sometimes telehealth is not the end all to be all, and we can miss some things. Telehealth, it prohibits the ability to use your other senses sometimes. And I can recall a case during the pandemic where a baby hadn't been seen by the pediatrician. The parent had been calling for support, couldn't get support. She said, I need in home support. Well, it turns out the baby could not effectively feed from mom's breast because the baby couldn't even effectively feed from a bottle. There were some tone issues. So, me as the advocate coming in, because I'm like, okay, let me see. No, this baby needs to be seen as soon as possible. So that's what I mean about being timely. We are essential, and it is really prudent and our duty to show up so that we do minimize harms caused to families, that we are accessible, because that's what becoming an IBCLC is about, is being able to provide accessible care at the time that it's needed. Collaborative care partner, I love this word so much because what it assumes is that you are collaborating with your client. You are not the center, you are not the decision maker, you are collaborating. Remember that it is the lactation, it's their family and their partners, it's their goals, it's their fears, it's their barriers that takes precedence over your goals for them. So I'm saying that to say that yes, we all know the recommendations, exclusive breastfeeding for the first 6 months at least. Like, we know those things, right? And it's important that we still honor those and we still talk about them. However, we also have to understand that we are collaborating in partnership, in agreement, that when someone seeks our care, that we make sure that we approach it in that manner and that we don't overstep some boundaries that are not meant for us to overstep. And that's how you become trusted. In all honesty, that's how you become trusted. Trusted to do no harm, to be reliable. Trusted to say that I see you as a person. I see that we're in this together. I'm not higher than you. We're collaborating to do what's best for you. That's how you become trusted. When you go into certain clinical relationships and you assume a hierarchy, like, yep, I'm the expert. I know all about this. I've been teaching breastfeeding and chest feeding for 15, 20 years. I'm going to tell you how this should work. You're going to lose trust, no doubt. When you go in and you touch someone without asking permission, they said they wanted assistance with latch. Let them tell you what type of assistance they were looking for before you just go in and just do all of that. That's how you become trusted. You are collaborating, you're there as the collaborative person. The Institute of Medicine defines patient centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So that's what we mean. So, I've talked a little bit about a culture. I've talked about collaboration. I've talked about care, the type of care you deliver, and how communication works. And the person is the center of all of those. And if you want more information, you can visit the Institute of Medicine and you can read a little bit more about person centered care. But person centered care has become a buzzword, really and truly. Don't let it become a buzzword for you. Really practice what this model looks like. And then that would further build trust with you, not just with the client, but within your community, also within even the other clinicians that work around you.